Well, the ADOS, which is the Autism Diagnostic Observation Schedule, is the gold standard diagnostic tool for autism. That diagnoses autism from 18 months up through adulthood because it has different modules and different, if a child's nonverbal, child's verbal, things like that. So there are tools out there that can diagnose that. Oh, wait, I'm sorry. So she wanted to, I'm sorry, just to recap, I keep on forgetting, they're taping me and I need to recap questions. She was just asking about the diagnostic tool.
Are these mandatory assessments, is this actually written into the curriculum where, say, a child will be diagnosed at 18 months, or what is the time frame? Is this something?
No, I mean, no, what they're saying is, so she's wanting to know if, when it comes to diagnosing, is it standard, 18 months, you're going to diagnose? No. What ends up happening, so typically the MCHAT, and we're running out of time and I haven't even gone through the Medicaid benefit yet. The MCHAT is the screener for autism, and that's what our Access Center is using, Pioneer. So what they're using is the MCHAT follow-up. So it's a series of yes and no questions that ask about the child's development, does your child enjoy being bounced on your knee? Does your child play with you? Does your child have imaginative play? And then through those series of yes and no questions, there's high risk or critical questions, they call them, where if the child meets so many of those questions, then you're at risk. It's not saying that you're going to have autism. It's just saying that you're screening on that higher end of a possibility of autism. At the same time, the MCHAT also has a very high false positive rate as well. But so, for example, our screeners for the Medicaid benefit are using the MCHAT follow-up screener as the screener to find out, okay, where should we move these families to? Say, for example, at your pediatrician's office. Pediatricians are supposed to do the autism screener at 12, 18, and 24 months, I believe. Only 20% of pediatricians use the screening tool for autism. So that's an issue. Something that we need to figure out and work on and work with pediatricians and train pediatricians. But as my pediatrician tells me, because we have these conversations all the time, I'm trained in infectious disease. I'm not trained in autism. And it's true. They're trained in knowing why the child has a fever, why he has the rash, why he's vomiting, why he has diarrhea. They're not trained in, this child has autism, this is what you need to do. For example, my pediatrician will tell me, one of our biggest things is we don't know we send them to early on, because that's the one thing we do know. But other than that, we don't know where to send them for diagnosis, and we don't need to know where to send them for treatment. We don't know what's good out there, what's bad, because they're in their pediatric world, again, diagnosing rashes and whatever. So, and it's not that they don't need to be educated, because they do, because the numbers are just getting higher, and there's no specialty in the medical field that's not going to encounter someone with autism at some point. So they need to know autism and the nuances of autism. So it's just where autism can be reliably diagnosed at 18 months, but again, like that statistic, the average age, 6 years, 8 years. So it's kind of just when you see those red flags and someone's keen to that and says to the family, something's not looking right, you should probably go get assessments and different assessments, diagnosis done to find out, is it developmental delay, is it a cognitive impairment? The other piece is with lead poisoning. Lead poisoning and autism mirror each other. So is it lead poisoning or is it autism? Who knows? So it's all those factors that play into, does that answer your question? Right. Nope, it's just a recommendation by the American Association of Pediatrics. That's it. No, I agree with you. I mean, I definitely agree that they need to be held accountable for, because, and it's not, and the interesting thing with this Medicaid benefit is we're not getting referrals from pediatricians. We're just getting referrals from other workers, or, families hearing about the benefit, and they might be Medicaid eligible and they want to know, they're going to bring their child in and get diagnosed. So, but no, the medical profession as a whole definitely needs to do a better job in training and knowing what autism is, because like I said, there's not going to be any specialty within the medical field that will not. I had a dermatologist from the University of San Francisco contact me a while back wanting to know, it was someone that knew him, that knew me, said, can you help me, help me understand autism so when I deal with children with autism, I know how to approach them better, and da-da-da. There's nothing out there for them. And it's kind of the fault to the field as a practice, So I'm hoping to see things change. So real quick, because we are running super behind, but it's okay because we've had really good dialogue and discussion. So the lifetime cost of a child with autism that does not receive that proper intervention, diagnosis, all that good stuff, $3.7 million over a lifetime. And that was in 2008, so I'm assuming it's probably tipping over $4 million. And then again, going back to that one slide where all the issues involved with autism, the diet, the sensory issue, if they're getting ABA therapy, applied behavior analysis, and if it's not covered by HAP or Blue Cross and you live in the state of Michigan and you have that insurance, or if you don't have My Child or Medicaid, you're paying $40,000, $50,000 a year out of pocket just for applied behavior analysis. You're not talking OT, you're not talking speech, you're not talking meeting with a nutritionist, any of that stuff. So you can see where that cost goes through the roof. However, a child that receives that early intervention and diagnosis, you could reduce that cost to 80%, so up to $650,000 a year. So that's huge. I mean, that's a huge lifetime cost for a family. So again, that's why early access diagnosis, and that's why we're doing these talks. That's why every month I've been doing an ASD101. Word is spread throughout the entire agency. Anyone that should be trained, come and listen, just so you know what to look for and spread the word. We're trying to get as many people out there as we can aware of what autism is and that how important it is for this early diagnosis and this early intervention piece. In Michigan, there's 15,000 children that have an IEP eligibility of autism spectrum disorder, ages 0 to 26. Approximately 20% of these children reside in Wayne County. 40% of these children reside in the Tri-County area. The other cool thing is we do have a Detroit-Wayne County Autism Task Force. We also have a regional task force that is Autism Oakland and Macomb County. And we meet regularly. We just met earlier this week. And we are, what is it that we could do as a region to help, battle the autism in this area? And some of the things is training reciprocity and things like that. So if a community mental health staff person was working in Wayne County or Oakland County and they got trained on recipient rights, say, or something, and they switched to the different county, that they wouldn't have to go through the training again, that they would have that training reciprocity throughout the 3 counties. So, we're really very aware of the needs in the region, and we're trying to work very hard to help families navigate the system and the benefit. This was Dr. Catherine Lord, used to be at University of Michigan, and she's one of the authors and creators of the diagnostic tool, the ADOS, for autism. And this quote probably came like 6 years ago, saying at that point in time, less than 20% of Michigan's children with autism received the access to the services that they needed in these therapies. So, for example, this Medicaid benefit that I'm going to talk about came from a Detroit-Wayne County community mental health consumer. It was a family member in Detroit-Wayne County, community mental health, that went to MDCH and sued MDCH saying, we know that applied behavior analysis is the most evidence-based therapy out there for children with autism, and my child's not receiving it in community mental health. What are you going to do about it? So now we have the Autism Medicaid benefit. The Autism Medicaid benefit covers ages 18 months through 5 years of age for children that are either eligible for Medicaid or My Child and are diagnosed with autism spectrum disorder. At one point, the age was much higher. At one point, they wrote it to 18, but then when the state crunched the figures, they didn't have the money to support offering this benefit to children of that age. So right now, it's to age 5. What I'm hoping is all the community mental health areas within the whole state, that are providing this type of therapy, the applied behavior analysis, to these families, we're going to start seeing a really good outcome for these kids and these families. So as time goes on, we'll be able to increase the age, increase the funding. That's my hope. I spoke to the ADOS before, which is the diagnostic tool, which is the gold standard used to determine the diagnosis of autism. So that is the diagnostic tool that needs to be used for this benefit. There are 2 levels of intensity within this ABA service. EIBI, which is Early Intensive Behavioral Intervention, which is provided 10 to 20 hours per week. And then that early intensive is that discrete trial training that I was talking about, where it's very one-on-one intensive therapy. Or ABI, which is Applied Behavioral Intervention, and that is for families who choose not to go the EIBI route, because some families do feel it's too much for their little people to sit and work through and go through. Or it's for also individuals that were diagnosed with PDD, NOS, or Asperger's. And that is offered on average 5 to 15 hours a week. And the hours for each of those levels of intensity is just determined by where the child falls on the spectrum, what type of functional outcomes they're working towards for that child. The other piece with that is any community mental health provider that want to be able to offer what's in this benefit has to have what is called a board certified behavior analysis, a BCBA, on staff to supervise the treatment offered in these 2 intensity levels. So that's one of the big things that we've been working on, is training staff on ABA, we're calling it ABA AIDS or behavior techs. So we're offering Oakland, Macomb, and Wayne County, if you go on the website, I think, are offering what is called ABA AIDS training. One's the end of this month on the 28th, and what it is kind of just teaching direct care staff principles of what ABA is, so they can help facilitate some of the treatment that's going to go into this benefit. But it needs to be overseen by a BCBA. One of the issues that we had in the state of Michigan is we didn't have a lot of BCBAs here, because Western Michigan and Eastern Michigan, and Western being internationally renowned of producing behavioral behavior or board certified behavior analysis, there was no really good income for them here, because we didn't have the coverage under insurance. We didn't have a Medicaid benefit. So when they came here and got educated, they all left the states where it was mandated to have ABA. So now they're slowly moving back, but we are working very, very hard to develop this type of workforce. The other unfortunate thing is, starting 2015, it's the board, so it's the national board, so the board analysis, I think it's BACB, I forgot it's the big board of all the behavior analysis. Social workers will no longer be a subset of a group to sit for the BCBA exam for whatever reason. They're kind of redefining their group of people. So like psychology majors type, that have a behavioral background, special educators are types of people that could sit for the exam. But as of, I think it's 2015, 2016, because I know some of our providers that have social workers enrolled in a program now will be grandfathered in. But once this takes effect, a social worker, which is hard for community mental health, because what is our system built on? Social work. So, and someone had suggested, which we're looking into, is writing a letter to the board saying, wait a minute, we have these mandates are going on across the country, and you are taking out a whole workforce that our system's built on to be able to help the intervention for these families. So that's something that we are looking into.